The C-SPAN networks bring you long-form public affairs programming from the nation's capital and are a public service of your television provider. C-SPAN, created by cable.
Senator Murray.
Thank you, Mr. Chairman. Before I start, I want to ask consent to put a letter to Chairman Alexander from all 11 Democrats on this committee on the importance of a second round of questions on this nominee. And I ask unanimous consent to put in the record 25 letters signed by 193 organizations opposing Congressman Price's nomination to lead the Department of Health and Human Services. And I also have a petition signed by 500,000 people from across the country opposing this nomination. I ask to put in the record.
They will be.
Congressman Price, recent press reports about your investments in the Australian biotech company Innate Immunotherapeutics raises some serious questions about your judgment, and I want to review the facts. You purchased stock in Innate Immunotherapeutics, a company working to develop new drugs, on 4 separate occasions between January 2015 and August 2016. You made the decision to purchase that stock, not a broker, yes or no?
That was a decision that I made, yes.
You were offered an opportunity to purchase stock at a lower price than was available to the general public, yes or no?
The initial purchase in January of 2015 was at the market price. The secondary purchase in June through August, September of 2016 was at a price that was available to individuals who were participating in a private placement offering.
That was lower than was available to the general public, correct?
I don't know that it was. It was the same price that everybody paid for the private placement offering.
Well, Congressman Chris Collins, who sits on President-elect Trump's transition team, is both an investor and a board member of the company. He was reportedly overheard just last week off the House floor bragging about how he had made people millionaires from a stock tip. Congressman Price, in our meeting, you informed me that you made these purchases based on conversations with Representative Collins. Is that correct?
No,
That is what you said to me in my office.
What I believe I said to you was that I learned of the company from Congressman Collins.
What I recall our conversation was that you had a conversation with Collins and then decided to purchase the stock.
No, that's not correct.
Well, that is what I remember you hearing it say in my office. In that conversation, did Representative Collins tell you anything that could be considered, quote, a stock tip, yes or no?
I don't believe so, no.
Well, if you're telling me he gave you information about a company, you were offered shares in the company at prices not available to the public, you bought those shares, is that not a stock tip?
Well, that's not what happened. What happened was that he mentioned, he talked about the company and the work that they were doing in trying to solve the challenge of progressive secondary multiple sclerosis, which is a very debilitating disease and one that I had the opportunity to treat patients when I was in practice.
I'm aware
I
of that.
studied the company for a period of time and felt that it had some significant merit and promise, and purchased the initial shares on the stock exchange
Congressman
itself.
Price, I have very limited time. Let me go on. Your purchases occurred while the 21st Century Cures Act, which had several provisions that could impact drug developers like Innate Immunotherapeutics, was being negotiated. And again, just days before you were notified to prepare for a final vote on the bill. Congressman, do you believe it is appropriate for a senior member of Congress actively involved in policymaking in the health sector to repeatedly personally invest in a drug company that could benefit from those actions, yes or no?
Well, that's not what happened.
Well, let me just say that I believe it's inappropriate, and we need answers to this regarding whether you and Congressman Collins used your access to non-public information when you bought at prices that were unavailable to the public. And again,
I had no access to non-public information.
Well, we will go on. Congressman Price, just last week, you and Republicans in Congress voted to begin ripping apart our health care system, which would cause nearly 30 million people to lose their coverage and raise health care costs for families without telling the American people specifically what you plan to do instead. President-elect Trump and Republicans in Congress have promised to deliver a plan that prevents anyone from losing coverage and leaves no one worse off. Just days ago, President-elect Trump said his plan would provide insurance for everybody. Do you share those goals?
I think it's absolutely imperative that we have a system in place that has patients at the center and allows for every single American to have the opportunity to gain access to the kind of coverage that they want.
You share his goal of insurance for everybody?
That's been always my stated goal. It's what we've worked on and throughout my entire public career.
Okay, if your repeal plan, the Empowering Patients First Act, was signed into law, would you consider these commitments to ensure all Americans and leave no one worse off be met?
The goal of the bills that I've worked on here in Congress, and understanding that the role, if I'm given the privilege of leading at HHS, is different, but my role in Congress was to always make certain that individuals had the opportunity to gain access to the kind of coverage that they desired, and that they had the financial feasibility to do so.
Okay.
That's what's different about the plans that we put forward.
All right, well, I think it's really important that we have clear answers. So let me just say this. Your bill only allows people with pre-existing conditions to obtain health insurance if they maintained continuous insurance for 18 months prior. Millions of Americans with pre-existing health conditions lack insurance for short periods of time. Under your plan, insurance companies could deny those Americans coverage for pre-existing conditions, yes or no, under your bill?
It's a broader question than that, because we would put in place high-risk pools and individual health pools that would allow every single person in the individual and small group market, who are the ones challenged with pre-existing illness, to be able to gain access again to the coverage that they want. So we believe through that plan that every single person would have the opportunity and financial feasibility to gain the coverage that they want for themselves and for their families.
We disagree on the consequences of that. Your bill would repeal dependent coverage available to young adults up to age 26. That is correct, right?
The bill that I authored did not include coverage up to age 26. The insurance companies have said that they were working that they were including that in their plans going forward, and so we felt it was covered.
Okay, and your bill takes away current benefits, which include prescription drugs, mental health, and substance use disorder benefits, and maternity coverage, among others. That is correct, right?
Again, it's different in the legislative arena than it is in the administrative arena, but there are other factors that we would put in place that would make certain that individuals had the care and the kind of coverage that they needed for whatever diagnosis would befall them.
Again, I disagree with the consequences, but your bill didn't cover that. Your bill also repeals the lifetime limits on coverage that helps a lot of people who are sick and have high medical expenses, like a person with cancer. Yes or no?
Well, again, it's a larger question, because what we would put is a different construct in place that would allow for every single person to gain access to the coverage that they want and have nobody fall through the cracks.
Well, I think just with these questions, I'm very concerned that your vision for a health care system is very different than one that I think millions of Americans are counting on.